I want to go back to not so much the political back and forth on it. I want to talk about the model that's in operation right now. So, look, the district that I'm in has one of the highest Medicare Advantage usages in the country. And we've long been a supporter of the program. However, the program has become increasingly costly and complicated for seniors. Constituents have described to me the countless stories of waiting weeks for approval for treatments that their doctors say they need immediately. Now, the reason I want to bring it up as a business is in the automobile business I'm in, we go through the same thing with warranty on both repair work and warranty work, and you wait and wait and wait for the authorization that whoever it is that bought that automobile brings it in to have work done on it, and you're waiting for somebody from the factory to go ahead and approve the work that needs to be done. We know what the work is that needs to be done, but we have to wait for the approval from somebody else to say, okay, go ahead and honor the warranty, go ahead and honor the program that these folks have bought for after the warranty runs out, but you wait and wait and wait for authorization. So, I mean, a lot of people say, don't compare this to cars and trucks. I'm talking about the ability to get up and do whatever you need to do every day and function. And if you're waiting for authorization to do something the technician knows needs to be done right now, that's a problem. That's a huge problem. So we all recognize that there's a problem. And so what I want to get, you're the techs, you're the people that are waiting on it. I'm a guy who's a dealer who I have 750,000 people relying on me to get them answers to whatever they think they have coming and say, you know what, get something done, get this fixed. So rather than take turns bashing about who's in the office at this time and who's not doing their job, just what could we do to make it easier? Dr. Boswell, if you would expand on this a little bit, because that's where I find out where the problem is. You shouldn't have to wait for things you already have coverage for.
Yeah, so a lot of this is streamlining the process, and so there's a lot of proposals out there right now trying to increase electronically streamlining it, which is certainly would be welcome. I can even give you examples. I was asked informally beforehand, you know, are you against faxing in records for stuff? We've got payers that I would love to be 1970s era faxing things in because we have to call them up and verbally dictate the history and physical allowed into the phone to get it into the record right now. And so there's a lot of work from an efficiency standpoint. The other side of that is figuring out, you know, what are the appropriate ones that should be flagged. If we're overturning more than 70% of the denials, then there's a lot of unnecessary administrative overhead that goes into that, and there's got to be a better way of doing that.
So, and Dr. Miller, you talk pretty much about the same thing, right? So codifications is a huge problem in anybody that runs any business where you have to file a claim. In our case, you may have the wrong serial number, you may have the wrong operation number, you may have the wrong flat rate number that you're supposed to be charging to fix whatever it is that needs to be fixed. This is a huge problem. And anybody, and I'm talking now just as a business, okay? And I hear all this different things about who struck John. Here's the problem. Here's the problem. It takes so much effort to put the right information in to get the approval on it. Things unnecessarily get held up. In my business, people are still making payment on our car or truck that they can't drive because we can't get authorization to go and do the warranty work on their car. This has become too complicated, and there's the number of mistakes that are made make it very difficult. I mean, part of what we call unproductive labor are the people that fill out all these forms that we get authorization for, get payment for. You face the same problem.
I'd say this is an operational problem that the managed care industry needs to get behind and fixing, and it needs to fix it in conjunction with the hospital industry, with doctors and the electronic health records. My iPhone has autocorrect. It automatically summarizes iMessages. I could set up, you know, automatic deductions from my bank account. We could, you know, invest in my retirement account here from my phone. All of these things can be done in an automated, simple fashion. We just need to implement those electronic tools and automation of process in care delivery. So that's something hospitals and doctors and plans need to sit down together and do it.
Well, listen, I want to thank you all for being here today. It is a business model. At the end of the day, I know we're talking about people's health. That's critical. But these things are all fixable. With what we have available today to do this stuff, we just need to implement it and put it into effect. Thank you so much for being here today. You guys are incredible. Thank you.